Dr. Rhonda Lowe joins us now with a look at a weight loss surgery that some British Columbians are going, well, deep south of the border to get surgery for.
Well, that's right, Colleen. Now, obesity has more than doubled in Canadian adults and children in the last 2 decades. Lap band surgery is one way to help these folks lose weight. But in BC, the procedure is not covered under MSP. Now, if you knew you could get it done at half the price in Mexico, would you do it? Well, one BC woman did, and she tells us her story tonight. Susan Fuller has struggled with her weight for nearly 15 years.
I've tried probably everything out there that everybody else has, healthy and not healthy, in terms of diets.
Now, at more than 90 pounds overweight, Susan needed to do something definitive and decided to have obesity surgery.
It's a health issue. You know, some people may say, oh, it's cosmetic. It's not cosmetic. There's lots of health issues with overweight people and obesity.
After extensive research, Susan and her friend Donna opted to have a procedure called lap band surgery in Tijuana, Mexico.
They have hospitals with the same standards or similar standards to what we have here in Canada and the U.S.
The cost is also about half of what you would pay in Canada, but Susan maintains this is not the only factor.
The doctor we went to see has done over 3,500 of these surgeries.
Susan and Donna are not alone. More Canadians are going abroad for obesity surgery as the demand and wait lists at home continue to grow. The lap band procedure is quick and relatively simple. Doctors make small incisions in the abdomen to help place an adjustable band around the top portion of the stomach, creating a smaller stomach so patients feel fuller faster.
We had the procedure Friday. We relaxed pretty much on Saturday, and we shopped for 4 hours on Sunday, and we flew home on Monday.
Because the procedure is minimally invasive, patients recover sooner, but must adjust to eating very small amounts of food, about half a teacupful 3 times a day.
This procedure is good and safe and simple.
Dr. Wayman Leung is one of the few surgeons in BC who perform lap band surgery. There is a 6-month wait list, and the $13,000 cost is not covered by MSP. Still, he advises against having the procedure in a foreign country.
There's a few done there and came back with infections, erosions, which they come to see me. There's no choice but remove it because no follow-up.
Susan's Mexican surgeon sent her home with reports, and her family doctor has agreed to do follow-up care. So now, she only has to focus on eating well and losing weight.
I'm looking to lose in the neighborhood of 80 to 90 pounds. Yeah. And I think that will place me at a decent, well, a realistic weight for my age.
Now, according to the Canadian Obesity Network, 250,000 Canadians meet the criteria to have obesity surgery, and approximately 2,000 surgeries, both public and private, are done each year in this country. Now, there are no figures on how many folks do go outside of Canada. And according to a recent research study, obesity surgery results in longer lives, with 56% decreased death rates from heart disease, 60% decrease for cancers, and 92% decreased mortality from diabetes.
All right, doctor, is the lap band procedure effective?
It is, Colleen, actually. Studies show that it's quite effective, where people can lose at least 50 pounds or more in the first year. Now, the amount of weight loss depends on many factors, including lifestyle and eating habits.
All right, let's talk complications, though.
Okay, well, like any surgery, there are problems and risks for things like infection, formation of blood clots, or complications from having a general anesthetic. Although overall, it's much less with this procedure because it's minimally invasive. Now, the most important issue is to comply very carefully with the diet instructions, and that's taking only very tiny kernel-sized bites of food, chewing food thoroughly, and eating slowly to ensure effect and prevent complications.
Unbelievable. Now, can it be reversed?
Yeah, in this case it can actually. Unlike stomach stapling or other gastric bypass surgeries, this procedure is reversible. Now, in the first year, most patients have to have about 3 to 5 adjustments of their stomach band depending on their progress. And it's expected that these kinds of minimally invasive techniques will one day replace more invasive procedures. But it remains to be seen if governments will consider coverage for at-risk patients. We don't know yet.
Fascinating story, doctor. All right, thanks so much.